Health inequity in Black and underserved communities is already a very serious problem. But what happens when you factor in COVID-19 and the flu? Welcome to Advancing Health, a podcast from the American Hospital Association. I'm Tom Netterly, senior writer with AHA. In 2017, AHA formed a strategic alliance with the National Urban League to focus on advancing health equity in Black and underserved communities and diversity and inclusion in healthcare governance overall. How is the alliance working out, and can it help with current conditions? In this conversation, Elisa Arespacochaga, Interim Executive Lead of the Institute for Diversity and Health Equity and Vice President of AHA's Physician Alliance, is speaking with Andrea Custis, President and CEO of the Urban League of Philadelphia, about health inequities in Black and underserved communities with a focus on the COVID-19 pandemic and the upcoming flu season.
Thanks, Tom. Today I'm excited to be joined by Andrea Custis, who has been actively leading the charge to help community residents in Philadelphia combat the social needs they're feeling due to COVID-19. Andrea, thank you so much for joining me.
Thank you for having me.
Let's start with a little bit about the history of the Urban League of Philadelphia, which you lead, and how your organization has really collaborated with the hospitals and health systems in Philadelphia to address some of the health inequities that you're seeing and really advance diversity and inclusion.
Thank you so much. So let me just give you a little bit of history. The Urban League of Philadelphia is an affiliate of the National Urban League. There are 90 affiliates throughout the United States of America, which is really good because we learn best practices from each other. We know what's going on in the United States. We have a view that we share with each other. And so that's been absolutely wonderful. We're a nonpartisan civil rights organization that has empowered African Americans and other underserved communities for more than a century. And we do this through what we call direct services. We do our work through employment, housing, entrepreneurship, health and wellness, a lot around education with the youth. And then all of this is under the umbrella of advocacy, where we speak up and speak out on social and racial injustice. We serve over 15,000 families and children, and we're excited about the work we're doing. One that I'm extremely proud of is that we've partnered with the Black Doctors COVID-19 Consortium here, led by Dr. Stanford, young African-American woman that I describe as one who doesn't sit back and see an issue. She runs to a problem. It has been an absolute pleasure to partner with her. She looked and saw that Black folks weren't getting tested for COVID-19. And she decided, I'm not asking them to come to us. We're going to the Black community. So we went with her to the Black community to help in testing to the underserved communities. One of the things one of the young ladies said to me when we went out was that, because I guess she thought that we did the commercial. We didn't do the commercial. A commercial said, we're going to do these wonderful drive-ins and you can just come. And she said, what am I going to drive? A scooter? A bike? I don't have that. And so this is why Dr. Stanford decided to go to the community to do the testing. We also partnered with Delaware County Foundation in order to distribute PPE kits in Delaware County, which was much needed for those that are in poverty. So we made sure that they had masks and gloves, sanitizer. In addition to that, just some other areas in the medical area, we were very passionate about immunizations. We looked and saw the data that said Black and brown mommies and grandmothers were not having their babies and their toddlers immunized compared to white females. And it was a big gap. And so we worked with Pfizer and we went to the community. We didn't ask the community to come to us. So we stayed at community fairs, everything that was going on inside the community. We were like the ever-ready bunny. Every time you turned around, here was the Urban League of Philadelphia showing up. We did a lot around education. We shared the information that we had. We had dialogues. We let people challenge us. There was a lot of challenges. And here's what I'm going to say to any doctor, any nurse, any practitioner in the medical field is that we all need to understand that African Americans do not trust the medical profession. We do not trust the hospitals, we don't trust the community centers, and we don't trust you as individuals. The reason why that is because of our deep-rooted history with the medical profession. And you can say, well, that's the past. It's very easy to say if it has not been done to you as a race. And so when I look at some of those things that individuals said to me face to face and I let them speak, they talked about things in slavery where we were digging up bodies, where there was a slave who was a runaway, you would start amputations on that individual. We talked about the Tuskegee syphilis study. That's known by every African American, how they were able to intentionally administer syphilis and then deny treatment. We talked about the civil rights area. They would bring up where if you are a Black activist, people started comparing you that you had schizophrenia and all those kind of things, any kind of label to put on you. So when you look at the Black community, please understand, as folks in that medical profession, you have a lot of work to do to change the minds of Black people on the level of trust, because in general, we don't trust you. We've also done a little bit of work with Jefferson Hospital, which is probably one of the fastest growing hospitals here. We are on advisory boards with them to look at what's going on in the Black and brown community and to begin to have that dialogue about what is it that we need to do, because Dr. Glasgow, who is head of it, recognizes when they have Black patients, those Black patients don't trust those doctors. So what can we begin to do? And then the other piece that we were working on is to make sure that Black folks have access to good quality medical care. So those are just a few things that we've done in the medical profession and tried to really collaborate and partner and work well with our associates there.
Wow. I want to underscore 2 points that I really heard there. The idea that you didn't wait for the community to come to you. You very much went to the community. That is one of the practical pieces here. The second is, and that's where I was going to go with my next question, is we know there is fear, there is mistrust of medical organizations among the Black community, among other underserved communities, certainly in the Latino community as well. And I'd like you to expand a little bit more, if you could, on how some of the hospital and health system leaders you've worked with, what sort of practical steps they've been taking to try to build that trust, to try to repair those relationships so that we can start to move forward and understand how they're working with trusted voices to build those connections.
What I do see is that there is absolutely an effort to really develop a comprehensive, culturally relevant strategy. And what do I mean by that? If you want to make a difference in that area, you have to look and start a strategy that begins to help you to understand the causes of racism and injustice in the medical profession. And then we have to identify and develop some practical interventions. So let me talk about one practical intervention to me, and we've seen it in corporate America. We're beginning to see it in the medical profession. And you first saw it with Starbucks here in Philadelphia, right? You saw two Black men who were in Starbucks, not bothering anything, having a dialogue, waiting for a business partner. You had a white female, originally from Ohio, that was working there, and she decides that these two Black men should have to purchase something or get out the store. Now, in the meantime, there are other Caucasians that are in there that also don't have products that they're partaking in, and nobody says anything to them. So she decides on her own to call the police, right? And so the police come, and rather than do a de-escalation process, they decide to arrest the two brothers. And I don't have to go on, but we ended up solving that, and they were very generous and gracious and wanted a fund set aside to help with the whole issue of implicit racial bias. And that is what the medical profession has to address. Whether you are a physician, whether you are a hospital, whether you are a medical school, for all of your students, for all of your doctors, for all of your nurses, for anybody that is in that profession, we need to be able to do training to talk about what is implicit racial bias. So I'm giving the benefit of the knowledge here too, that you're not doing it intentionally, although we know there are individuals and institutions that are intentional and focused on racism. I'm assuming that individuals haven't been put under the microscope to do some introspection to understand what is implicit racial bias. What does it look like? How do you know that? And so I need all of these medical institutions and individuals to be able to put that in the curriculum. I can tell you from what I know, I'm not a doctor. My daughter is a doctor. I've asked plenty of questions. I have a lot of friends who are doctors. Not one of them have said to me in the period of time that they went to medical school that there was ever any mention of implicit racial bias. There was never a piece of the curriculum that dealt with social injustice, racism, or any kind of biases that you might have if I'm African American in poverty or severe poverty. I come to you, we have a dialogue. I've not seen that. So I am saying that in order to develop the strategy, in order to look at this, you have to address the role of implicit racial bias. There has been a study, and they looked at doctors in particular, and they found those that had high levels of implicit bias, that they were more likely to withhold treatment from a Black person. So that's one study, and they use this tool called implicit association test. The other thing I will say to you is I recently had an experience, and I was having a dialogue with my own doctor. I had changed doctors. I now am in a position where I'm going to go and give some feedback to the head of the practice, because I felt like as a Black woman, that the number one thing was, you're asking me a question, but you're not listening to me. And I know when you're listening to me and when you're not listening to me. And I felt like we were talking across each other. I felt like that doctor had all kinds of biases on what you think when you see a Black woman. And it didn't work for me. And I said to myself, oh my gosh, this is the first time that has ever happened in my 68 years on this earth. And I said, now, how does it feel, Andrea, to walk in the shoes of what my brothers and sisters are walking in every day when it comes to access to quality medical care? And I will tell you, I was angry. I had to take a deep breath. And then I said, though, you have a teaching moment here. So you need to go talk to the head. You need to also go back to her, which I plan on doing, and to give that feedback and how it felt devaluing. And I won't go through all of it, but it was quite a bit of information that I will be able to feed back: language, body language, conversation with me, what you heard, what you didn't hear, and so on. So I'm going to take that as an opportunity to give some feedback. I really hope that the medical schools in particular will really take time to properly train the doctors from the very beginning, as well as the nurses. Let's just talk a minute about the whole issue of access. And I hope that we all understand that that is a huge problem in the Black community, that we have huge gaps in healthcare disparities. And as I just mentioned, it has to do with the social determinants in the health industry, right? And so when you look at things like education level, and we can't move into denial on this, you look at whether you're employed or not, housing, healthy eating, all of those things, there are huge gaps in how white individuals and Black individuals are treated in the healthcare industry. And I would just like us to also just continue to be sensitive to our long history of discrimination in the medical field. And what I do applaud is those hospitals that are currently aware of it and have decided that they are going to make a difference, and they've put coalitions of people together to listen to them and to figure out what is it that we need to actually do in terms of a direct service to the Black community. And I don't have to tell you about the many stories we've seen, especially with Black women in childbirth, that we've heard from entertainers, sports people. I think even a young man whose wife died at childbirth was even trying to get a bill passed in Washington, D.C. I don't know whether he was able to get it passed, but we certainly, I think you would agree, have quite a bit of work to do in the hospitals and with our medical professionals.
Absolutely, Andrea. And I know we have a few resources related to the implicit association test. It's out of Harvard, available on our website. And I've been very heartened to see that the Association of Medical Colleges really has taken this on as an issue and really passionately focused on addressing the need for additional training in medical schools, certainly at hospital level. And that last point hit home. We lost one of our own team. And if I could just direct us a little bit towards the approaching flu season plus COVID, I know everyone at our hospitals and health systems are really working hard to make sure everyone gets a flu shot so we can reduce as much as possible the incidence of flu this year. Hopefully we'll be able to reduce incidence of COVID as well. How can hospitals and health systems reach out to the community-based organizations that you work with, and groups like the Urban League of Philadelphia to really increase that awareness and encourage this prevention and people getting flu shots, given all that we've just talked about? What are some of the ways we can work together to do that?
That's an excellent question. And the fact that you're asking that question tells me that you are aware and you understand. So we have an individual here, State Senator Vincent Hughes, who has been a great partner, and something that I remembered from him when we have been talking about COVID-19 and contact tracing. I'll use that as an example. He has said to Harrisburg, to the governor, to all of the medical help that we get from Harrisburg and the government, is that you need to use organizations like the Urban League of Philadelphia and other community-based organizations, because the work that has to be done, there is a huge trust factor here. And so people need to see people that look like them. And so his expression is always trusted messengers with a trusted message. When we went out into the community and we saw like thousands and thousands and thousands of individuals, not one time did anybody have an issue with the level of trust and loyalty that we have for our community, and they in turn have it for us. So I would say for anybody in the medical profession, partner, collaborate with groups like the Urban League, because we know how to take that message to our community, and it absolutely works. I did a PSA for Pfizer when it came to immunizations. And also I looked at when we did little surveys to see, as a result of having the dialogue, as a result of us educating you, has it changed your mind? Would you get your child immunized? The answer was emphatically yes. The caveat that they gave, and they have a right to give it, is I want somebody that looks like me that will do those immunizations. And we encourage people, you have to select your medical professional however you want to do that. That is your decision, and it should be one that you give a lot of thought to, and maybe you need to interview a couple of people. But I would absolutely say that those individuals need to partner with community organizations like us to help them with that work. And we've seen where it has been extremely successful, extremely successful.
Absolutely. And I know we're partnering with the National Urban League, and we very much appreciate sharing some of the PSAs that I know from the hospital field we've put together around flu shots and wearing a mask and so forth. So thank you for continuing to spread that message.
If I can just add one thing, and I love the way she said it too, just like I gave Senator Hughes. I love the way Kamala Harris answered the question when she was being challenged about when the COVID-19 shot comes out, are you going to take it? Are you going to recommend it to others? And I'm just repeating what she said. Nonpartisan, but I like her comment. I like comments that everybody makes because it's practical. It makes sense. She said, I'm not sure. In fact, I can tell you, I am sure. I'm not taking what comes out of the White House on that. But what I will take and absolutely get that vaccine is when doctors who know what they're talking about, who are the subject matter experts, people like the CDC, when they say that this vaccine is safe and you need to take it, basically what she said is, I will run, not walk, and take that. But I won't take that based on not a trusted messenger that doesn't have a trusted message. She would not do that. And I thought that was very appropriate when you think about almost everything we do in the medical field. It's the trust that we have for those individuals. Because remember, this is life and death in many situations. And we have data over and over that I've read in so many articles that I can have the same illness that a white female has, and yet I'll be twice as likely to die from that same illness than what my white counterpart. And that's definitely scary. So this is life and death issues.
So as we wrap up, do you have any other advice that you give our hospital and health system members beyond, obviously, the immediate needs that we've been talking about around COVID and addressing some of these social needs, but to really effectively foster health and wellness in the Black community, in underserved communities?
Yeah.
Some advice that you'd give as we close out.
Here's a piece of advice that I would give, and someone's going to say that sounds corny. It's not corny. It's genuine. It's from my heart. It is what is needed. I want the medical field to show empathy and love and care for the Black community. I know we work from our heads on this one. I also want you to work from your heart. My community deserves that love and that care. They deserve that equally to any other patient and anybody else that you are providing medical care. I want you to listen to what we have to say. I want you to clear your mind of any myths, any biases that you have, and respect me as an individual and listen to what I am telling you, because it's my life, it's my health. And so please listen and pay attention to me. And then I want you to give me 100% of what you have to offer. And I'm going to say this about the medical profession, but in general, Americans have an enormous capacity for compassion. And so what I'm asking you to do during this COVID-19 and going forward, I'm asking you to show me your compassion. I'm asking you to show me your love and care for my people. That's the best advice that I can give you at this point.
Well, I could not have said it better. I think compassion is something we all strive for, and I think it is the message that's going to keep us together. So thank you so much, Andrea. I very much appreciate you sharing your time and your expertise, and I wish you the best.
Thank you for allowing me to speak up today, and stay safe.
Thank you so much.